Happy Monday, everybody. It is another beautiful Monday here in Lake Norman, and that means that it is time for the Lake Norman Woman podcast. I am Mamie Lee, editor-in-chief of Lake Norman Woman magazine, here with my beautiful co-host in green, looking gorgeous. Hello. Love it. Very springy. I got the pink, you got the green, looking very springy. We've got a great guest with us here, too. Dr. Eva is here with us, and we'll get more into that and get to know her a little bit better as we go. But gosh, Katie and Eva, what's happening for spring in Lake Norman?
Allergies, pollen,
the
coughs.
pollen.
Poor Natalie Ray's allergies are kicking.
Bless her.
But
it's rough.
It is. It's really rough.
It is. It's a tough time of year. You know, I will take the allergies, though, over the cold every single day. Like, I'll take the river of pollen running through my yard over just being cold and you can't even get outside. You know, I'd much prefer that.
Yeah. I love that the birds are singing, the flowers are blooming. The pollen is just one of those. You have to take it until we can get through, and then everything will be beautiful.
That's right, because once the pollen's gone, then the mosquitoes show up.
Yeah.
I've always found.
They're here.
They're already here?
Yes.
You guys already seen mosquitoes? I have not seen any yet. Oh, that means it's going to be a tough season. Ooh,
it is. And you would have thought with how cold it was, they all would have been gone. But no, it is definitely full-blown mosquitoes, pollen, everything. But that's okay. We get to go outside.
Yes. And lake season's going to be here before we know it. I know, getting out on the water, getting to know. And Eva, this is our first time meeting in person.
Right.
And we'll get a lot more into, but I do want to jump in with you first. You know, usually we wait until the second segment with our guests, and Katie and I chit chat. But Eva and I have known each other for over a year, maybe.
I think so.
But just Instagram friends, right?
Right.
And so Eva, I call her the queen of the sunsets. She takes the most gorgeous sunset videos and pictures from, I'm assuming, your home.
Yeah. Just in Cornelius. And I started posting them, and then you started liking them, and I was like, I'm going to tag her and see what happens.
So I get all the credit too. Everybody's like, oh, beautiful picture of the sunset. I was like, it's not me. It's Dr. Eva. It's not me. Like, I have nothing to do with it. I just enjoy them so much. I am a sucker for a sunset. I'll say every time. I love a good sunrise too, but a nice sunset to kind of end the day. The beautiful, I mean, that's one of the reasons I wanted to live here so much, because I love a sunset over the water so much. So to be able to live somewhere where you can see that every single night of the week is just such a gift to me. That's my calm place. That's where I can feel centered. And I just love a sunset. And my family makes fun of me all the time. And I'm like, did you see the sunset? Yes, we saw the sunset tonight. And I was like, I just love it so much. So a lot of times vacations, where we go and where we stay, is always determined on Key West was always on my bucket list, because they had such beautiful sunsets. And that was one of the things that they would say, the most gorgeous sunsets in the world. And I was like, oh, good, I have to go. And now I love going there, because
sunset.
That's one of the things that I love about it. But yeah, just being able to go there and see that, and that beauty in the nature, and just being part of it.
Well, it's amazing how a blue sky or a dark sky can make such vibrant colors. And it just changes and morphs and grows, and it goes lighter and darker. There's so much dynamics in the sky when you think about how big it is.
Yeah, absolutely.
For me, it's like you made it through another day.
Right? That's such a good thought.
I love a sunset, and it's never the same. Mm-hmm. So it's just you can look at it and breathe and feel like, however your day went.
Yeah, I've made it through the day. I can get up and do it again tomorrow. It's a fresh start too. You know, it ends the day. And like I said, I love a beautiful sunrise. But for whatever reason, the sunset has always just been my favorite thing. And so I will chase a sunset all day long. Like some people chase rainbows. I'll be like, no, it's over there. No, it's over there. Okay, I know the best spot to go. But we moved from the west side of the lake to the east side. And so we don't get those beautiful views. So I appreciate yours even more now, because I can't capture those gorgeous sunsets like I used to be able to when I lived on the other side of the lake.
Well, you can catch her the sunrise. She can get the sunsets. And I'll just enjoy all of it.
There you go. All of it in between. Yeah, I've got another friend, Lori, who sends me the most gorgeous sunrise pictures from her dock too. So I feel it's just been such a gift of living here. It's just getting to be a part of nature every single day. Yeah.
And even, I guess that is even the thing when you're sitting on 77.
Yes.
You can experience a sunrise and sunset while you're sitting in traffic.
Yeah. And just enjoy the beauty that we have all around us, even when you're not the most ideal place. So Katie, what's going on at the farm these days?
We are just rocking and rolling. Yeah. It's one of those that we're transitioning, we're growing. Everybody's
Mama watch, how we doing?
We're still pregnant.
Okay.
Hopefully, we're going to be soon having a baby.
Did you say llamas are pregnant almost a year?
They are.
Wow.
Mhm.
Wow.
Yep. And we don't really know because Dad visited for a period of time.
We're not sure at
really
what point.
what the due date is, but she's looking pregnant.
Okay.
So that's a plus. So hopefully anytime you will be the first person I call.
Oh, I can't wait. I
have
can't
the
wait for
baby.
the baby llama pictures. Yes.
I see a
am,
live
honestly.
stream. I've delivered babies, but never animal babies. So
No,
is
because
there a-
9 times out of 10, they have them when we're not around.
That's what you were saying.
Her
That
last
kind
baby,
of go
we
off.
didn't even know she was pregnant. And we came out in the middle. Actually, it was
that
the
happens with humans. too.
guys. Yes, it does.
Oh, I bet you got some stories.
The guys at the body shop called us for the last baby that we had and was like, you guys have a baby llama in your pasture. We're like, do what? And yeah, he
Just had the
That's
baby. You
awesome.
had
had a
no idea?
baby. There was a baby. So
Do they usually go off on their own to have the baby? I just remember
No
from
idea.
dogs. Yeah, like dogs would or cats would kind of like go off on their own, and just from friends of mine growing up and kind of have their babies in private. Like they didn't make a big announcement about it. So
probably.
I wasn't sure if llamas or other animals did the same, or horses if they do the same.
Horses, it depends. With any of the babies out at our place, they just surprise us. Like we can tell when they're getting ready, but it's definitely been like we walked out and there was a baby.
Well, I
So-
can't wait. I can't wait for the announcement, the flowers, all the things that are going on. Now, I did see something that you posted on your social media about a women's group that you're starting through with Soul to Soul. Is that correct?
The Women's Healing Circle, that one's through Willow Equine.
That's through Willow
and that
Equine,
is
okay.
truly a time for all of us throughout generations have always come together. Women have always sat together, whether it's in conversation, whether it's healing, whatever modality, they've always come together and had a safe space. And so I really want to start reintegrating that into our community. And so I'm going to have my drums, we're going to have rattles. You'll be able to draw, you can meditate, we're going to have conversation, but it's really just a place to allocate 90 minutes out of your day once a month to come out to the farm and reconnect. And we'll see. I might add more if it goes well and we enjoy it, but it's that intentional time. And I think all of us can get too busy in everything we've got going on, whether it's the kids, whether it's our personal lives, and just to be able to like, no, this is on the calendar and I'm doing it.
Yeah, I think that's what we have to do as women, though. We have to like intentionally make time for ourselves. Now, there is that time of like zoning out, scrolling on your phone, right? That's not really going to help your mental health.
No.
Probably doesn't help
Unless you're looking at
No.
sunsets, but no.
Probably won't
Right.
help your physical health either. We love a scroll. We love a scroll moment. I love I call it I don't even know what I call it. I've lost my brain now. I need to do it
You
again.
have to turn your brain off. and
That's
it's
what it
something
is.
brainless.
It's just that
It's like a
mindless
checkout
kind of
moment.
thing. It is a check. That's right, Katie. That's exactly what it is. It's a checkout moment. It's just like, I'm going to go sit in my bed and scroll for 30 minutes. But at the end of the 30 minutes, it's time to be done
Right.
too. You know, don't want that 30 minutes to turn into 90 or 2 hours. But I think that what you're doing is really important too, to have something that's on your calendar once a month. We've said before, once a month is doable, right?
Yes.
If you say I'm going to do it every single day or every single week, that can get overwhelming because then you've made this commitment to yourself. But once a month is definitely manageable.
And when it's on the calendar, then
Yeah,
hopefully it doesn't get scratched out or
Absolutely.
overridden.
absolutely.
So,
What do
It's
you
okay to make it a priority.
It is.
It's okay to make you a priority.
Absolutely.
It's definitely okay. What are you hoping for these women when are you hoping for them to like get to know each other and gather together, or is this more of an individual kind of meditation? Okay.
Both. I really think it's a time because like energies attract. And we know that we've seen it through this podcast. We've seen it through the Bin 110 events.
Mm-hmm.
When you bring people together, there's a power there. And we all need the healing. And so I want there to be a safe space for women to connect. Maybe you'll have a more intimate relationship than you will with others, but you're still making that time to form new relationships. And then being at the farm and healing, having that healing that comes from the farm, you're also able to connect in with yourself.
Yeah.
Because you have to have that deeper relationship with yourself in order to be present in and amongst the world.
And will horses be part of this, or is this just
Course.
Of course.
Of course.
Of
We'll be out in the
course.
horse pasture. We'll figure out when people get there what pasture we want to be in. Probably a lot of it will be dictated with the sun. In the summertime, we'll probably be down by the creek. We'll be in the woods. But starting off here in the spring, we'll be out in the middle of everything.
Oh, that sounds so nice. Lovely.
Amazing that you created a safe space for someone that may not feel comfortable and like come out and try it and do something you've never done before, because you might make a new friend or you might just connect with the environment and have a moment to yourself that you deserve.
Or you might see that this
So proud of
therapy
you.
is, this therapy might be what's for you too. So it gives you a chance to like dip your toe in the water without jumping into it fully too.
Yes. And it's one of those that I tell people always, give me a call if you want to come see the farm, but I really want that intentionality behind it. And so come out for healing, come out for connection. And then if the therapy or team building or any of the other healing work fits into your life, great. If not, still you've made this time for this circle, or maybe some of the other circles and groups work.
And this is for any woman, any profession, any age. Is there an age range that you want people to be in? I mean,
Just come on.
All right. Sounds good. Oh, my
Everyone's
gosh,
welcome.
Oh, now I want to go.
Come on.
Sounds so calming and relaxing. And but we've got a lot more show to do, so we can't go right now.
Not yet.
We can't go right now, but we will be back after some messages from our sponsors on the Lake Norman Woman podcast. See you in a minute.
Dreaming of starting your own podcast but don't have the space or gear? The WSIC Podcast Studio has everything you need to bring your content to life. With multiple sets that can be tailored to fit your needs, state-of-the-art lighting, and camera equipment, you'll be ready to create high-quality content. Need a photography studio? We've got you covered with our professional cyclorama wall. Bring your own camera and let our expert producers handle it. Email social@WSICnews.com to schedule your tour today. The WSIC Podcast Studio, where your ideas come to life. Looking for deeper self-discovery and emotional growth? Soul to Soul Connection offers supportive space where horses help you understand your inner world in ways traditional talk therapy can't. Our certified professionals guide you through meaningful experiences that foster reflection, healing, and renewed perspective. Best of all, these services are offered at low or no cost for veterans, first responders, and their families. Learn more at healingwithhorseslkn.org and start your journey toward greater well-being today.
Imagine a home where every inch is designed just for you. At The Closet Niche, they create custom solutions based on your specific needs. From closets to build-ins, garages to wall beds, their locally created solutions deliver functionality and elegance. With a lifetime warranty, best price guarantee, and award-winning service, you'll see why they've won Best of the Lake 2 years running. Get your space reimagined. Visit theclosetniche.com today.
Welcome back to the Lake Norman Woman podcast. Mamie Lee here with my co-host Katie Stakowitz, and we have a fantastic guest in the studio today. We've talked to her a little bit already, but this week's guest is a powerhouse woman who's on a mission to shake up the healthcare world in the best way possible. Dr. Eva Imperial, known as your Dr. BFF on social media, is a mom, entrepreneur, dance mom, and daughter of immigrant parents, juggling life just like the rest of us. But behind the scenes, she's also a double board certified physician with 2 decades of experience from medical missions to private practice. Now, as CEO and founder of iHLTH, Dr. Eva is focused on making healthcare more accessible, transparent, and affordable, starting with something we all need but often overlook, lab testing. She's all about cutting through the confusion and putting patients over profits. I'm so excited to dive into her story of how she's helping women everywhere take control of their health. Welcome to the podcast, Dr. Eva.
Thanst for having me.
So nice to meet you in person, too. I know. This is so surreal. I know we've known each other virtually for so long. So sitting here on the, with you on the couch here in person has been just so nice and lovely to get to meet you. And I'm excited to get to talk to you and know you better. But tell me about the inspiration behind iHLTH, because I know Katie has a little bit of involvement in it as well.
Yes. So being on the side of healthcare of just trying to help people, and that sounds cheesy, but that's why I wanted to go to medical school. I love science, and I was able to learn about the business of medicine that I did not know. They don't teach you that part in med school. And having patients that were in between jobs, or, I know what they need medically, and I'm sending them and writing all these orders and trying to figure out what's wrong with them and sending them for tests. What I didn't realize is we all assume that insurance pays for things, or that people that are in the business of healthcare are providing a service at a reasonable rate. You don't know these things until I hear it from the patients. And it was awful to hear that someone was in between jobs. And I'm like, well, you need to get your stuff done. You need to get your cholesterol checked because of your family history. You need to be screened for diabetes and things like that. And then they wouldn't tell me. They would just follow my instructions because apparently I'm convincing to say you need to take care of yourself. Put yourself first. This is your health. You've taken care of everybody else. And to hear them come back, because then I started asking like, well, what was the challenge? Or we couldn't get insurance to cover that or whatever. I didn't realize what the patients were going through as far as costs. So being able to provide a service and kind of healthcare hack and find a way for patients to get what they needed without, and having another choice without the crazy expensive lab bills is where we started with, was great. And cause you don't know, like, I don't know if anyone has experienced that where they got a bill of weeks later and they didn't know it was going to be that expensive.
I think we've all had that
We've all
sticker
been in that
shock
spot,
after
yeah.
the fact, right? Because there's no upfront pricing there. Sometimes you get the bill that says like, you may have to pay this much, but you're always just like, hopefully I won't.
Or I have insurance. It's covered.
Or I have insurance.
I think that's the
all
hardest one is
assumed
just
it.
like, oh, I have insurance. So everything's covered. Oh,
No.
Not always.
No,
Not
no.
And
always.
nowadays there's less
and
coverage.
Less and
So
less
just
coverage.
because and it's great that you, like I have patients that are like, I'm so excited to have insurance, and I have to caution them now and say, that doesn't mean everything's covered. You have a deductible, you have a co-insurance, you have all these terms that are mysterious. The analogy I like to use is imagine if, I'm sure y'all have taken a flight in the past year or 2 years. Imagine if you checked your bag, right? You have to like I check a bag. I don't know if y'all check a bag.
Yeah, yeah.
And what if they didn't tell you how much that bag was going to cost? So you knew how much the flight was. You know where you're going. You get a bill 4 to 6 weeks later of, oh, by the way, that bag you checked with us is $300. How would you feel about that?
Yeah.
Like it's a secret, right? So
Right.
that's healthcare. It's not.
It's already done. So you can't
can't
go
do
back
anything
and say,
about it.
like,
You can't go
no,
back
I don't
and
want
say,
to
no,
do
I don't wanna do this.
It's
Yeah.
already done. I mean, it's a good business model for them because the work's done.
Right.
Right, where I feel like transparency is super important. And when you order labs through iHealth or get services, we tell you up front there are no hidden fees, and we're cheaper and less expensive and more convenient and more efficient than an average hospital or doctor's office, because I've been there. I've been there. I want my patients to have access to things. Life is already stressful, so this is one thing in healthcare that I could help somebody. The most challenging thing is, how do I tell the people that you can come through us, because everyone is accepting of how healthcare is. They're like, well, I think insurance will pay for it, and I'll just go through insurance, when I know that if you go through insurance, the games that the insurance companies play to help their bottom line is, we're not going to cover hormone testing. We're not going to cover those things, but no one can tell you ahead of time.
Right.
Or they can rarely tell you ahead of time. iHealth does that.
Right. And also I think you could help be transparent with, maybe you need this, maybe you don't need this. I mean, is that something that you consult your patients on as well? Like, maybe these are some of the tests, whether it's your age or the condition you're suffering with or anything like that. Is that something that you help the patients understand what maybe they need to be asking for?
Right. And it's also the right to know. And if you have a healthcare professional that you have trusted with your health, and they just say, you don't need that test. Like, I don't know how that would make me. I know how it makes me feel when I know that someone needs the test. But people are told more and more, you don't need that test. Or what's that test going to tell you? Why do you need to know what medications you need to be on? We're just going to do trial and error. Or you have a family history of heart health. Well, your insurance is not going to pay for a genetic test. I've managed to negotiate better prices and not go back and forth with prior authorizations. And this is how much it'll be. And we've made it easy for patients, because life is busy. Because you know what most women are
those
going to
prior
do.
authorizations will kill me. I will say no, never mind. If they said, oh, this needs a prior authorization, I'm like,
no,
ugh, never mind. I don't need it. When I probably do. But I just don't want to deal with the runaround. It's just such a pain.
It is, and it's a pain for it creates burnout for healthcare professionals and their staff, because they already know that you're going to have to fill out another form. And guess what? What people don't know is AI is being used in all kinds of businesses. It's being used to deny claims even faster from insurance companies, and that's public knowledge. They know.
So it's just looking for like some keywords and then just automatically denying it. Yeah.
And saying no, telling the patient no. And you pay for the insurance. you pay for the insurance. You think that it's going to cover something. And, you know, you don't know until you've been through that system once. So my hope is either get the word out that we're here as an option, or if you've had a terrible bill, follow us so that we can follow me so I can tell you how to get a correct bill or how to fight it, or use us and not have the hassle, because moms and women will say, well, I'm just going to make sure my kids are taken care of. I'm going to make sure that my sister gets the medicine she needs. They're going to put themselves last.
Absolutely.
And they can't continue to do that.
No, you can't, because really, if the mother of the house, whoever's kind of running that household, is not taking care of themselves, herself, it's going to be really, really hard for everybody else to function around them. And that's something that I think everyone in this room has learned the hard way before too. Like, I'm just running. I still have a chipped tooth I need to get fixed. And I'm sending my daughter money for spring break over getting that done, because I was like, it's fine. It's fine. I know. I've had it for like 6 months too. I got to get it fixed. I will. I'll make the appointment. I'll get it done. But it's just that thing of like remembering to take care of yourself first. And we say it all the time on this podcast. You can't pour from an empty cup. You can't. You definitely can't.
Results actually can dictate or help explain why your cup is so empty.
Mm-hmm.
You
Absolutely.
see all these things. You see the kids, the work, the expectations. But then there's like, well, I should be able to push through this. Why am I so tired?
Mm-hmm.
Why is this going on? Why is that going on? And those test results are answers, or can be clues to answers that you're looking for.
Right. Whether it's vitamin levels, whether it's and every week the government will come out and say, yeah, we don't need to do vitamin D levels anymore. Yet the osteoporosis is happening, things like that. And they don't want to pay for it. So I had a nurse friend who texts me, and she texts me a copy of her bill, and she's in healthcare. She knows healthcare better than anybody else. And she said, look at my lab bill. And I was like, why don't you just come through us? You know what? You've heard me talk about this business. And she's like, well, I thought insurance would pay for it. And then her question was, why was my vitamin D so expensive? I'm like, well, it's an expensive lab. And your insurance clearly doesn't want to pay for it. And so she stuck with that bill because it's already done. I can't do anything about
After
the bill now.
Yeah.
And they will send you to collections. They will, and that made me mad that that I had coworkers that worked for organizations, and they got sent to collections, and they're employees. They're showing up every day.
Yeah.
And it's
and
affecting their credit.
System.
And they know the system, but they didn't know the cost. They didn't know how much going to hospital XYZ, wherever it is in the country, was going to cost them. They assumed their insurance that they pay for out of their paycheck every 2 weeks was going to take care of that. The fact that I can healthcare hack and, provide a transparent price that's going to be cheaper than most hospitals, especially if you don't have insurance. If you don't have insurance and you go and get labs done, they're going to be so expensive.
Well, you're not. I would venture to say most people won't if they don't have insurance.
Right. They're going to choose not to.
So feeling so poorly that it's like a last resort, because who wants that financial weight?
Right.
Well, that makes me so sad about healthcare, because there are diseases we can prevent. And
if you know what's going on,
if you know about it, or you can make a change, everyone's trying to get their hands on weight loss medicine. Well, I'm telling them, I'm like, do you know that if there's a medical reason why you can't lose weight, or what is happening to your body? And I had a friend who went through iHLTH and said, can you screen me for diabetes? Because I really want to lose weight. I'm like, this is great. So we did the test. That this person was not expecting to be diabetic. So I think they had to, come to grips and go, well, I knew I was unhealthy. I didn't know my family history. We don't talk about those things. And so now that he has that information, it might be it's supposed to be a little easier to get the diabetic medicine that he needs that will also have a side effect of losing weight. He is now understanding the prior authorization process. So even though he has the diagnosis, at least he knows.
But he didn't even know.
He didn't even know.
He just wanted to lose weight. He didn't know how bad his body was struggling.
That his body was hurting too, and that it needed more than just the weight loss to help counter effect what was going on with his body.
Because in my mind, I'm thinking, wow, I'm glad that we found out.
Absolutely.
He was sad and scared. I think everybody gets, when you get a bad diagnosis.
You want an answer, but you don't want that answer.
Right.
I see it as now it's an opportunity to do something before something happens, before you have a heart attack, before you lose your toes and fingers, your
Have a
vision,
seizure.
or something bad happens, you know?
It gets much worse. Yeah,
I
absolutely.
like the data. I'm a nerd. I like knowing, but then I like seeing the improvement.
Right.
You know, and being able to say, okay, I can control certain things. I can't control genetics. I can't control if I'm male or female because, you know, women have heart disease as the number one killer. It doesn't matter how much access we have to having access to health, right? And information. We're still a country that is overweight and obese, and not knowing that you're just a simple blood test, not knowing that you're diabetic.
That's huge.
Yeah, that's a huge. All right, we're going to take a quick break, and then we're going to come back and talk more. We got a lot to talk about today, too, so we may need 2 episodes for this one. I'll let you know. All right, guys, we'll be right back after these messages from that are sponsors for the Lake Normal Woman podcast. Thanks, guys.
Ready to create your podcast, video, or photo shoot? The WSIC Studio is your one-stop shop for all your content needs. We offer multiple sets that can be tailored to fit your vision along with state-of-the-art lighting and camera equipment. Plus, our Cyclorama Photography Studio provides the perfect backdrop for stunning visuals. Bring your own camera or use ours with expert producers to guide you. Email social@WSIC News today to book a tour. The WSIC Podcast Studios, your content, our expertise.
Are you ready for a fresh approach to healing and personal development? At Willow Equine, our certified professionals offer equine-assisted therapy that harness the powerful connection between horses and humans. We provide counseling, mindfulness, and leadership development tailored to your unique journey. Discover new insights and transform your life through the sensitivity and wisdom of horses. Visit healingwithhorseslkn.org to learn more. And begin your path to well-being today.
Winning Best of the Lake 2 years in a row, The Closet Niche is not only locally owned and operated, but their products are manufactured right here in Lake Norman as well. With a lifetime warranty and best price guaranteed, they deliver stunning, high-quality designs tailored to your specific needs. From closets to pantries, laundry rooms to garages, and more. Their work speaks for itself. Visit theclosetniche.com to get started on your 5-star experience today. Visit theclosetniche.com today.
Hey guys, welcome back to the Lake Norman Woman podcast. I'm here with Dr. Eva, which is now your name forever and ever, yes. Dr. Eva. I do want to talk to you about, because you mentioned in the last segment about how you were working in the medical field. I assume that was a lucrative career, you know, a nice comfy salary for someone who's working in the medical profession. Then you decide to go out on your own. So for the ladies that are listening, they're in the C-suite. They have these great careers they've worked for, but they really have this desire to do something else. What's the advice you're going to give them?
That you go for it.
Go for it. All right. This is our first. Mark it down. Write it down, guys. This is our first that said go for it. Everybody else has said don't do it. Don't do it.
This is why, because you and I try to be that hype girl for other people who reach out to me, whether it's friends that want to, sell costumes online, or like, I feel like we can do hard things. We can, but
Absolutely.
You need that encouragement to do it. And is it lonely? Yes. Is it scary? Yes. Is it hard? Yes. Like, do I cry about it in my car because I'm like, oh, I messed up again, or I made the wrong decision, or why didn't I know about this before? Yes. But there's, if like for me, I know healthcare. If you have something that you're passionate about and that you know about, then share it with the world. Why keep it to yourself? And you have to sometimes just take that chance on you. And you can find friends or networks of women or whatever it is that you need, or business people that are entrepreneurial, to support you and to give you good advice, but it's scary. I mean, it's hard. Mm-hmm. And I didn't know anything about business or QuickBooks or invoicing and purchase orders and things like that and negotiating. But yeah, it's the scariest thing, because this is the year that I said, well, we're just going to pour everything into iHealth because we have people to help. I have a mission. It's a crazy mission. And think about it. I'm fighting what everyone knows about healthcare. And they've accepted that it's okay that you get overcharged. It's okay that it's inefficient. It's okay that you have to wait weeks to get an appointment. Like, I have so many ideas, and I just had to pick one and pick the right team to support me, which is a very small circle, and pick and choose what advice that I choose to take, and know that at the end of the day, I made the right or the wrong decision. I failed at lots of things. I got told no a lot. And so I like listening to podcasts where it's people who did the scary things and just do it. Because otherwise, how do you know?
That's
Right.
I mean,
You
that's
have
what
to
we're trying to do here. We're trying to be transparent, right? We don't want to scare anybody off from doing it either. And I was at a networking event on Tuesday night, and somebody was like, I work in the C-suite and I love it. And I was like, good for you.
That's great.
That's great, because we need women who are in the C-suite too.
Absolutely.
You know, who are doing that and are making those big changes for these big corporations. We need that as well. But I don't think we want to scare women off from doing it. We want to just encourage women to do what is in their heart, what's their passion. And for some people,
to be real. We want the situation, whatever it is to be real. When you're like, you never fit in the box of healthcare because you were too much of an advocate for us. And you knew what we needed to then be able to say, like, okay, this isn't working. I've got to create something that's going to work. Same thing with me. Office therapy doesn't work for everybody. Let's create an opportunity where you can heal on your own terms, or
It's
on
not
fair
one size
terms, or on
fits all.
transparent
It's
terms.
not.
Right. We're not one size fits all either, you know? And what I tell myself is there is no success without sacrifice.
Oh, absolutely.
And I
that's so
remind
good.
myself that every day, because if you see me and I'm working late at the office and I work some long hours, I've dedicated so much time as a W-2 employee to other people that I was like, why am I not pouring this into something that I feel passionate about, that I get to control? So yes, there was a time, many years, that I was working and dedicating long hours to somebody else. They got 150% of me. And it was for my patients. Like, I didn't mind working late and fighting for the ultrasound that patient really needed. When they told me no, I'm like, I'm the doctor. You're telling me no. My patient needs an ultrasound. I need to make sure that they don't have uterine cancer, or they need it. So I was always fighting behind the scenes with team members to fight for our patients that don't even know. They don't know that I missed so many dinners. They don't know. And it's okay.
When your kids were little back then.
They were.
When you were in the office, the kids were lit. The girls
you
were
were
little.
sacrificing a lot of time with them too. And not to say that like anybody on that entrepreneurial journey isn't sacrificing time with their family too. I mean, they are, but ultimately you're doing it to build a better life for you and your family, and to feed that passion that you have. You know, sometimes I think it was our very first guest with the Closet Niche, with Annie from the Closet Niche, who was like, you know, I just had this deep desire that I wanted to do more. And so when you lean into that, and like you said, it's going to be scary. It's going to be hard. It's going to be frustrating. There's going to be days that you cry in your car, and that's okay. And there's going to be things that you miss out on too. But you know that you're doing it because you're feeding that passion. And when you do that, yes, it is hard work. You know, you hear the saying all the time, do what you love and it doesn't feel like work. There's days it still feels like work.
Oh yeah, it's work. It's work.
It's work.
There's days it feels like, I mean, it's work. It's hard work what you guys are doing and what you guys are building. And especially you're a year in. And so it's hard work, you know, there's sacrifice involved for sure, but it's definitely something that's going to be worth all of that hard work that you're putting in. All right. We are running out of time on this episode. I know. So we have not even scratched the surface with what we want to talk about today. So we are going to do another episode. Can you stick around?
Of course.
All right.
Good.
All right. You guys join us next week for part 2 of the Lake Norman Woman podcast with Dr. Eva, Katie, and myself. See you guys next week.
Have a great week.
Bye.